Basha, so what's your reaction to this, that fewer than half of trainee GPs actually go on to work for the NHS full-time? Why is that?
I'm not surprised. I'm not surprised at all. It's something I've considered myself. I think it's just a case of weighing, cost versus benefits. The current system, it doesn't allow us, for me personally, my reasons would be, it doesn't allow me to fully enjoy my work, the cost cuts all around and the workload and how much we're expected to do in like a 10-minute appointment. It doesn't make you feel very good as a doctor to be able to have to rush things and, try and do as much as possible in that short time. I think it's quite a high stress environment, and it doesn't surprise me that's why people are choosing the private route or going abroad.
Are we at risk of over-interpreting these figures? These numbers not doing full-time work, lots of them will be doing part-time work, perhaps a huge proportion of part-time work. I don't know quite what this definition encompasses. They could be working for the NHS 95% of the time and still be counted as part-time. Are we at risk of over-interpreting this?
Yes, quite possibly. And I think, in that way, the radar is too highly on these GP trainees and GPs that why are they leaving, and what, do they not owe it to the government or the country to stay and work? But yes, you're quite right. A lot of people are definitely working what we call less than full time. And it's definitely a very good option, especially for in the current climate where, there's a high demand for GPs and their work, and equally there's a lot that's expected of us. So in order to find that work-life balance, I think a lot of my colleagues are definitely opting for the less than full-time route.
And Basha, this figure will obviously include the GPs and the trainee GPs who go on to work in Australia or Canada or the like, where they will earn higher salaries. And you just said just then that it's something that you have considered as well, leaving the NHS. So what has that conversation been like in your mind? Why would you want to leave the NHS? And why, in the same breath, are you proud to work for the NHS? What are the good things about the NHS?
I've always been very proud to be part of the NHS, mainly because how inspiring my colleagues have been. I've had great role models, and, it still feels amazing when you have that good patient interaction. And that it's not just a transactional interaction. It is something that, you're providing this service. I've worked in the NHS for 4 years now. It is a fantastic organisation. But equally, when you have to measure up with what your own life goals are, for instance, in this country, the taxation is really high compared to what we're being paid and how we're being compensated for the time and effort that takes into becoming a doctor. And also the high stress levels. I think, finding a balance. And for me personally, it's a case of affording housing and all these things. I have definitely considered going abroad for a short period of time, getting enough earnings to have a good quality of life where I'm not having to completely be bogged down with bills and worries about cost of living. And I didn't expect that when I was at school and doing my best and getting the highest grades in school. And I could say that for a lot of my colleagues as well, that absolutely we went into this profession wanting to help people, but it's the compensation in this country, it's not good enough at present.
It's fascinating you talk about the high taxation that doctors face, because this is a conversation we've been having all morning. I suppose on the one hand we often think about the high tax burden that this country has and actually the 40% funding increase that the NHS has had, that perhaps is a really inefficient allocation of resources. If we're taxing doctors to then put money into the NHS, probably losing some of it along the way, losing it in inefficiencies, it doesn't seem like it's a very well put together system.
And you're absolutely correct. I've been hearing all the conversations about across the board in terms of the system. I think there's something fundamentally wrong with the system when you're losing 10,000 doctors a year. And that's not just, doctors, that's nurses as well. And absolutely, the taxation system in other parts of the world are, I suppose, better weighed up in terms of to match the earnings, to match the role that the entity is playing in terms of building the economy, building the society, and contributing to services like the NHS.